Hey everybody, welcome back to a second chance. My name is Philip Jones.
And my name is Tafaro Cook, two-time kidney transplant recipient and founder of Kidney Care Coaches, where we coach people with stage 3 to stage 5 kidney disease. If you or you know someone who has kidney disease challenges and needs to be coached, hit us up at kidneycarecoaches.com.
Now I know the title's second chance with guest Taiylor Kriss, but couldn't make it today, so we're making a little change to the show today. So today we're going to talk about um, mental health comments, which we like to call Mr. Cook. Go ahead. You said brain challenges.
I like to call it brain health. And the reason why I like to call it brain health, because
Oh,
sometimes,
that's right.
yeah, the stigma of mental health, it's a stigma on it where people think that something's wrong with you. But I believe if we can make the brain healthier with, maybe with communication, maybe with therapy, all these type of things, that you can have a healthier brain opposed to just saying mental health. That's my belief.
No, I agree with you. So the article that we're going to read from is out of the Medical Day. And we're going to start at the section where it says who's at risk. So it
Okay.
says several factors increase the risk of mental health conditions among men. The following groups may be more at risk than others. The first one is older white men. White men aged 85 years and older are most at risk of suicide. More men in this demographic die by suicide every year than in any other group by age, sex, or race.
Wow. I wonder why. I wonder why. I mean, um, you know, you 85, you didn't live your life. And they saying just the majority of them is white men. I'm pretty sure it's all types of people. So I just won't say white, but all people. But men at 85 is where I'm going. But I wonder why men at 85, when you lived your life, you think it might be regret? You think they might have some regret? A man that gets 85 and he's like, I regret I did this, or I should have did this. I should have started that business. I should have, found my own true passion or whatever. What you think that reasoning is? Because I don't have a clue on that one. That's a new one to me.
I, I can go with the regret answer, um, but honestly, first thing that I would say is, I mean, you 85 and like you said, lived your life already, and you hadn't taken your life. So what's the point of doing it now? You might as well live the rest of the time that you got left on Earth. I mean, especially if you're in good health and you can move around, you can drive. You can go to the park, be with your grandchildren if you have them, or nieces and nephews, or whatever, and just live life. I mean, there's no point in doing it now if you didn't do it
Unless
before. I mean,
what
I
the
don't.
only reason I could say it might be a challenge is if they're not healthy. That's where I'm at with that. And but you said unless you said you're healthy. And I agree with you. I agree with everything you're saying. If you're already healthy and you've already lived your life, I mean, honestly, those are the days you chill if you're healthy. But sometimes when it comes, sometimes we can look at people and they might look healthy, but the brain might not be healthy, especially if you're thinking about suicide on the regular and thinking about all these things on the regular like that. Having crazy thoughts and bad thoughts. I shouldn't say crazy, but unhealthy thoughts. Let's say that unhealthy thoughts. Then I could see, because the brain might not be stable, and that's where we're going with that. So we're not talking about the physical health. We're talking about brain health. So if the brain isn't healthy, I could see this happening. I'm gonna talk about the other one.
Okay.
Men who have experienced trauma. Men who have experienced trauma. That's in this group too. A traumatic event, such as engaging in combat or being a victim of an assault, increase the risk of experiencing post-traumatic stress disorder. That's true. I have a couple buddies of mine who were in the military, and they're military veterans, and they talk about their post-traumatic syndrome from being in combat and all kinds of stuff like that. And sometimes they share, some things, and I'll be like, wow. But with that being said, I'm gonna keep it real. I feel doing dialysis for over a period of time is some form of post-traumatic syndrome. Going through kidney challenges, and when you gotta get transplants at that level, you can't tell me that's not post-traumatic syndrome because you go through a lot, especially when you're living on this machine and you're waiting in the for somebody to say yes, we can let you have this organ and stuff. So that's a lot of trauma too, and it's a 24-hour a day trauma. So I believe post traumatic can be all types of things, and it can mess with you mentally. What's your thoughts on that, Phil?
Uh, yeah, no, I agree. I mean, I actually have a post traumatic stress with my seizures. I mean, I don't uh drive to this day because I'm scared that I'll have a seizure in the car while I'm in traffic or something because I've had seizures in public before. So
Mm,
I that's always in the back of my mind, and I'm slowly getting over and through it because eventually I gotta drive, get places, get to work, things of that nature. But I mean, it's just it's always gonna be in the back of my mind, because of this kidney failure. So, and I know that's the reason why I had those seizures is because my kidneys were, had failed. So, until I get, another kidney, it's always really going to be in my mind that it can happen. So, I understand it.
I got you.
Uh,
I got you. Yeah, that's a good way, man. I understand that. And so, therefore, when you hear us talking about that, it could, post traumatic comes all types of ways. I was driving in the car today with my daughter. We were on the highway, and she says, she goes, I see her start getting kind of nervous because we were about to pass an 18 wheeler, and I go, "What's wrong with you?" She goes, "Daddy, I remember that time you told me when you and mommy were going on a trip, and you watched this truck, was going sideways because of the wind." I was like, "Yeah, but that doesn't happen to 18 wheelers all the time." Yeah, but she's like this. I'm still kind of nervous every time we go past a 18 wheeler. That's a form of post traumatic syndrome. You know what I'm saying? And I'm sitting there
yeah,
like, don't worry about that every time we go past a truck. But to her, that's a big deal. And so whatever strikes you in certain ways, man, we don't know what it can be. But I tell you, man, I saw this dude get shot when I was 12 years old at the park, right? Right up the street where I live. These dudes
hmm
was playing basketball. I'm sitting on the sideline just dribbling, just playing because they older dudes and everything. And I seen this dude. They were talking stuff like all dudes do on the basketball court, going back and forth. And this one dude, man, he pulled out a little 22 and shot this dude, man. And I never forget that. And it was like pap. And I was like, I just happened to be watching them argue, and the guy just pulled out a gun and shot him in the stomach twice. And I was like, oh, it messed me up to the point, man, where I ran home. I ran home. I dropped the ball and ran home. I was so scared. And I had some slight nightmares on that. I keep it real, and I still remember it to this day.
No, hey man, tell your daughter she's not alone, man, because I've been in a car accident before, and it was the funnest situation that I've been in before. So
Right.
especially when you don't know what's happening to you. I just had surgery on my meniscus on my right knee,
Mhm.
and so your leg is in this like kind of stiff cast, and so it's stuck out. I can't bend it. I normally in the car kind of
Oh my God,
bent
man.
or it's just straight out, and we ended up running into a car ran into us, and this other lady that was speeding at like a billion miles per hour smashed into the back of that ran into us originally.
Mm.
But like the it was like a ripple effect. It just like went through the car that was
Mhm.
behind us, went to us, and it just like all the force, kind of like leg because like I said, like it was just stuck out, you know. So even to this day, I kind of have PTSD from that, Um,
Yeah.
So, I mean, we all deal with things our own ways, and so, but yeah. So the next one is men experiencing employment issues, working in poor
Mm-mm.
conditions, or having a high workload can increase the risk of mental health issues. Unemployment and retirement also increase the risk of depression and suicide. I can see the unemployment and retirement, well, more the retirement part causing depression and maybe a little bit of suicide. Not really, but that's just if you're doing anything with your life. I mean, you go from the workforce to just sitting on your butt at home doing nothing. It'll drive you crazy. All you do is watch TV. You're not exercising. You're not driving anywhere. You're
Well,
not doing.
I think it's more to it than that because what happens when you stop working after you retire, you're going to this building or you might be working on the line or you might be doing whatever, but people need you. They need you. You know that you're needed. You feel needed. And then all of a sudden you retire, no one needs you anymore. The company, no one's calling you no more. That interaction is gone. Just like prime example of that, and I'm gonna relate this back to dialysis is once you get a transplant, like I was in dialysis, I was in hemo for 5.5 years. I had just did peritoneal for 6.5. Man, once I got my transplant, that void of dialysis is gone. You know what I'm saying? All that time that you was doing and stuff like that. Where I've seen people, I was happy at mine. Don't get me wrong, I had a lot of stuff to do. I have business, everything. But a lot of people feel depressed after that because a lot of people at dialysis they become their friends. They get friends, and I got friends there too. So I would go back and visit and stuff. But you almost feel like I even had people tell me that they were like they felt guilty, like man, I got a kidney and nobody else got a kidney at my dialysis center. That kind of thing. So that can be some traumatic, depression on that kind of stuff too. And I like I said, man, I got a kidney. And I had to wait 30 days, 30 more days in the hospital because I had some other stuff going on. But
Right.
when I got back, I had all this time, man, because dialysis is I had 4.5 hours to run, but you got to have an hour just to get there. You know what I'm saying? You got to prepare. Then it's an
Hmm.
hour afterwards, or, longer than just an hour afterwards. So then you got to get home, then you got to recover and all that. The dialysis is a whole day. Again, though, you have that void, and people feel a little slight like I've had people like I said have like feel depressed because no one else got a kidney but them. You know what I'm saying? So it's all kinds of stuff like that. So I get where you're going with this, man. I'm gonna read the other one. Um, Men who have had marital breakdowns. That's big, man. So I'm gonna read this. Depression is more common and more severe among men who are divorced. One study suggested that being single is a significant suicide trigger among men. Mm, one study said that. I don't know, man, because most dudes I know who are single, man, they ain't thinking about they ain't thinking about being depressed. Now, if you got problems as far as if you, I'm just keeping it real. If you got problems in your marriage, that can make you depressed because you're going through that. But once dudes get
Right.
divorced, most dudes be like, good. So I don't know about that. Most dudes be like, I'm gonna be all right. I can see women being depressed after they get it because they're void. But the dudes I know who, don't get me wrong, they want women and stuff like that, but I don't see them being depressed. I ain't never seen that, so I don't know what to
Yeah.
say
No,
about that.
I
What's
don't
your
know.
thought?
Not. I don't know a man that's been divorced that's suicidal. Mo- Most of them going around acting like they got $1 million or something, but I
They be
don't know
like, they
about
be at the
depressed or
club. They,
suicidal or
I'm
nothing.
telling you, man, them old OGs be at the club. They be like, yeah, we about to go kick it. They be
Man.
looking at the young girls. They be doing their thing, man. They ain't thinking about that no more. They be like, take these shackles off my feet. I'm about to kick it. Hey, so that's a different dude because that's the dudes I know. They be man, they be like, I ain't never getting married again. But yeah, that's crazy. So I don't know about that one. Go ahead with the next one, man.
Men with legal or financial concerns. Having legal or financial worries can trigger the development of mental health problems and increase the risk of suicide. I can see that being true
Yeah, I can
because
see
when
that too.
you are, living paycheck to paycheck, not knowing if you're gonna have your job the next day, it might have been a temp job, and you hoping that you get, hired permanently or whatever the case may be. You going job to job or place to place, things of that nature. You don't know, if you're gonna have a roof over your head the next day. I can see that being a reason.
I'll
Um,
tell you another big reason, like you're saying right here. I had homies who were in legal problems, with child support, or got pulled over by the cops and was
mhm.
dirty, and then now they got to go get court fees and all that stuff. Man, that can make your money funny when you got to go pay a lawyer, then you got to pay the judge and everybody else, all because of something. So I could see that could be depressing for sure, man. So yeah, go ahead.
I think it's you next.
Okay, I thought you had something else to say about it.
Mm-mm.
Okay. Men who misuse alcohol and drugs. Man, come on now. You waiting for everything to happen when you're doing that stuff. Men are more likely to engage in illicit drug use and alcohol use, which can trigger or exacerbate mental health conditions. I agree with that to the fullest, man. Especially when sometimes the alcohol make you have, you get your ego, you get your alcohol ego, you be doing some crazy stuff. And then sometimes alcohol could be a depressor. When if you drink too much, you feel, you start reflecting on what's going on in your life. And your life might not feel as good as you want it to be. And, so you drowning all your sorrows in that bottle. And then you be like, man, you know what? I'm not worthy to be on this earth. You can have some other problems where, I don't see my kids. They don't think I'm worth nothing. All kinds of. You can start talking yourself down that rabbit hole, and that can happen, man. So especially with those drugs, because they can alter your mind. What's your thoughts on that, Phil?
All I can say is this just goes with every other health issue that we've ever talked about on this show that is connected to misuse of alcohol and drugs. This is another reason why you shouldn't do it. We're not telling you not to do it at all, but we're telling you to uh, be
Don't
conscious and
abuse. Don't abuse it.
right. Don't abuse it. Right, right. Don't abuse it. Use it wisely. If anything, um, it's not all that serious to just drink your sorrows away because it's not possible. First off, the
That's
more you
right.
drink, the less out your mind you're going. So, and the more drugs you do, the more brain cells you're burning off. So, like we're telling you not to do these things at all. I mean, I don't drink. I don't think Mr. Cooking too much, if
I don't drink.
anything.
I don't drink at
I
all.
know he do cigars or whatever like that, and I don't
I'll
smoke
do
at
a
all.
I'll
So
do a cigar. I'll do a cigar, but I won't drink no alcohol.
yeah, no, it ain't all that. It ain't that serious, and so I mean, yeah, it's coming from kidney patients who kind of have to live that life, but it's also for the benefits of your own health as well. So
I'm
you
cool
know,
living that life. I ain't got to never touch. I'm telling you, man. Last time I drunk, I might have had a sip here and there where I went to wine sip, and I might have tasted a little bit or something like that. But the last time I officially drunk, when I was 22 years old, man. So I ain't never missing that. Alcohol ain't my thing. I will smoke a cigar every now and then. Cigar mellow me out a little bit, but I ain't touching no alcohol. That's for sure. Yeah, I agree with you on
it
all
ain't
this,
nothing
man.
wrong
You're
with it.
right. And if you don't abuse it, just like you said, I agree with you, man. If you don't abuse it, if you could have a little sip, a little wine down after, man, I like some brandy, I like some bourbon. And I got friends that like that kind of stuff, and and I don't demonize it. And they get a drink with their cigar, man, sit back and chill, and that's their thing. And I ain't mad
Right.
at them. They go get them a taste. That's cool. But when you abusing it and it's making you think alterly, when you thinking crazy because and you got to have that every time, something ain't right. That's when you got to look at yourself and be what's up. And then another thing is, men out there, if you're experiencing any of these things, go see a therapist. You never know what can be hidden underneath all your thoughts. What's causing these problems? It could be a childhood trauma thing. It could be something going on that you never even thought about. That's why, again, men need to talk more. Men need to have conversations. Or if you can't find somebody you're comfortable with, go get a therapist, man. Try, or do something where you can let out your feelings so you can let it out. Phil and I talk about that, man. Women, man, they talk all the time. Whether even if it ain't no therapy or nothing like that, but just getting some stuff off your chest make you feel better. Instead of just holding it all in. I'm a man. I'm gonna keep it strong. Yeah, talk about that heartbreak. Talk about that job that messed you up. Talk about if your money funny or something like that, or if your health going on. That's why I feel a lot of men wait too long to get health problems because they don't talk about it. They don't have nobody to share with, and we don't want to go to the doctor and find out. So I just rather not go. You know just what I'm talking about, bro. We've been on the circuit talking to people and everything, so you understand where I'm coming from.
Yes, sir. Most definitely. I agree with everything you just said.
I think you up.
No, it's you.
Okay.
Oh no, it
All
is
right.
me. I'm sorry. Because you did just do men who misuse alcohol and drugs. That's right. Men with a family history of mental health issues. Most psychiatric conditions include bipolar disorder, depression, and schizophrenia. Run in families, suggesting a genetic component. Um,
Wow.
find these things out early in life. Expect. And here's the thing: I feel that it's not up to the younger person to find these things out. It's up to the older person, the parent, to tell their kids if certain things run in their family. So they make the decision, when or if they want to go get checked for that disease. Some people don't want to get checked. They rather just find out when it happens. Some people want to know if they're gonna have to deal with it or not. Now, that's a decision that's totally up to you. But I feel that the parents, the older people need to go to the younger people and tell them when certain conditions run in the family, so they know they can make their decision early in life. Okay, yeah, when I turn 18 or whatever, I'm gonna go get checked out, for bipolar disorder, or this illness or that illness or whatever. Let them make that decision. Don't let them figure it out later on in life, when they could have found out before, and put things in motions to make their life easier. So that's all I got on that. What about you, Miss Cook?
Man, I agree with you on that, man. But a lot of times, a lot of parents or older dudes don't even know they got it. You know what I'm saying? They just tripping too. I seen some of my good friends spaz out and act like their dads, and I'd be like, wow, what's really going on? I had a friend, man. He, I had a friend that was a real hyper dude. My boy, real hyper, and I trained his son one time, and I used to train his son for football and everything, and his son act the same way. And I was like, what's really going on? He reminded me of his dad, like hyper and kind of crazy on some stuff too. And I was like, so what? But what goes on is this: if the parent is not diagnosed, if the grandparent is not diagnosed, they don't know. You don't know what you don't know. So therefore, and I agree
Right.
with you. If they know, tell them, hey, I had this problem, blah blah blah. I want you to go get checked out. But if you don't know, and you think it's just something else, especially in the black community. Let's keep it real. How many black community? How many men, especially born in the 40s and 50s, black men going to see therapists? That ain't
But the
gonna
thing,
happen.
but the thing about it is that it doesn't start with that parent. It starts before that parent. So
And that's what I'm talking about. And
if your
hold on. And that's
grandparent.
what I'm talking. That's what I'm talking about right there, though, Phil. Your grandparent ain't went to no therapist. Your grandparent before that ain't went to no therapist, and your daddy ain't went to no therapist. Men don't even go now. So it goes back like you said, when the generations is just happening. And 9 times out of 10, especially when it comes to men, I'm talking about black men, white men, all men. You just act like your daddy. You crazy like your daddy. You crazy like your granddaddy. How many times have we heard that in the community? That's what I'm talking about. So if you don't know, you don't know. But if you do know, I agree what you say. Tell the younger ones and everything. But if you don't know, and I agree that I keep it real. If they did a study on that, how many people know and how many people gonna get help on it, man, it's gonna be highly likely. And we talking about men at this too. So what's your
Yeah.
thought?
No, I agree. Nah, you made a good point by saying that men don't go to therapists. I mean they don't even talk to their boys, so went to a therapist. I
Right.
mean you would think they would be more likely to talk to their homies. Than anything. You would think it would be, logically speaking, it would be a lot easier to talk to somebody that's bound to keep what you say confident, in confidentiality and quiet and can't tell nobody. I
Hmm.
mean, your boys, they're your boys, but y'all get to talking with other homies, and then your business gets put out in the open. I
That's
mean,
right. That's
to
right.
me, it would be smarter for you to go talk to somebody that's bound technically by law to keep what you say in confidentiality and secret, and to themselves, instead of talking to somebody where it possibly can get out. Now it's not intentional, it's not always intentional, but this goes back to the drinking and the drugs. People lose control of themselves, when they overdo it. Stuff comes out. It's just how it goes.
And so imagine this. Imagine this combination. Let's just put this together. You're talking about a storm, and we've seen this. This is nothing new, especially in the men. And we're talking about men. What if you were, let's just say, what if you were a veteran in the military? You were in combat. Your employment situation ain't the best. You drink a lot of alcohol because you trying to cut this thing. You drink a lot of alcohol because that's what you like to do. And all of a sudden, um, and you got a history of mental health problems, brain problems, I should say. And I'm not talking about, that's not like I'm not saying like, oh, that's one of the few. No, that's a lot of dudes. That's a lot of people. You know what I'm saying? That's a lot of people out here in society in the first place. That's just a regular person, a person who was in the military, who was in combat. Their employment situation ain't the best. Um, they had some problems with the law. They drink a lot of alcohol, and they already got some challenges in their brain. I'm not talking about the unicorn here. I'm talking about just a normal dude. And
Yep.
as we talk about these things, that is a combination of a person ready to explode and do something bad. And I'm not talking about, again. I'm talking about just a normal dude who could be your neighbor. You feel where I'm going? So I'm talking about the common man. Let's just say that. I'm talking about the common man. What's your thoughts
Yeah.
on that? It's crazy. So we got
Yeah, it
and
is. It
earlier
is. It is. It's
earlier I read something about, I told you about that, man. We talked when we was off, and I said, man, smiling depression. Wow. And I was like, man, I got to read that article because I got to read up on that because it talked about people who hide their depression. They go to work every
yeah.
day. They might go to the gym. They might, be real productive in society, but deep down inside, man, it's pained up. They pained up, and that's called smiling depression. And a lot of men have these challenges, man. That's all I want to say. But I'm gonna take this next one, man, because I'm running my mouth too much. Men dealing with other life challenges. Okay, other risk factors for mental health problems and suicide include physical illness or discomfort, conflict with family or friends, and the illness or death of a family member. Wow, man. That's what I'm talking about. So these storms can happen. And if you're not stable, up top. That's why we see people unload. That's why we see people do some things that they shouldn't do. I ain't gonna call them crazy, but they do some things that we'd be like, wow, what happened to him? What's crazy is when you hear somebody do something and they interview their friends and stuff like that, they be like, I didn't even know he was just at work. He was just cool, and that's what we're talking about. That smiling depression right there. The person who can go to work, can do all these things, and still have these challenges. What's your thoughts on this last one, Phil?
That smile and depression is called putting a mask on it. Um, it
Mm-hmm.
you know
Mm-hmm.
we pretty much know about the physical illness aspect of it and discomfort. It's been most of our life. Um, but I for me, it's when you say conflict with friends. I'm not even gonna touch the family part because everybody has their own opinion on that. But it's too many people in the world for you to feel suicidal, over people, you know, leaving your life when it comes to friends, when it comes to them just like leaving, not necessarily passing away, but just not in your life anymore. It's too many people in the world. You go find another friend. Some people ain't meant to be in your
Phil,
life
Phil,
the
your
whole time,
mental
anyways.
Phil, your brain is stable. You don't know how other people might depend on somebody, with a situation going on. So it's easy for you to say, but we have to take ourselves out and put ourselves in the shoes of somebody else who might not be stable upstairs, and that's what we're talking about. So and some people live isolation, man, where they can't just go get another friend. So you got to think about these situations too. A lot of people aren't charismatic. They ain't charismatic like yourself. You go out here and just meet dudes, and everybody like Phil. But everybody ain't like that. Some dudes are kind of reclusive. They kind of weird, and people be like, man, that dude weird. That dude crazy. So it's different. It's not. You can't just say that.
Yeah, I mean, no, I understand. I mean, because I speak as well as listen. I know I do this show every week with you, and I seem like I'm the most open person in the world, but I'm shy as all hell. So it's the easiest thing for me to make friends. And most of the friends I probably made by telling jokes or something because that's just how I was when I was younger. I was that joking dude. After about 10th grade, that was just me. I was, I mean, I was serious about my schoolwork and everything like that, but I'm saying like on the outside of school and things of that nature, when you're out at nutritional lunch or whatever, I was a joking person. That was just who I was. That's probably how I met most of the people I know, in my life that are my friends, So, but believe me, I mean, I understand. I mean, I was friends, for a minute. It was like, was it me? Was it them? Like, you contemplating, where the problem was. So, I mean, I understand it, 100%. But like I said, it's not the easiest thing for me to make friends. I just maybe as I just carry myself a different manner than other people. But like you said, I gotta put myself in their shoes. They might only have that one friend, that's what's carrying them is that one friend. So, I get it.
Yeah. Go ahead, man.
So the next section is common mental health conditions in men. So it says some of the most prevalent mental health conditions are the first one is depression. Depression characterized by persistent low mood that interferes with everyday functioning worldwide. It is one of the most common mental health conditions. Depression is almost twice as common in women as men. However, men are far less likely than women to seek treatment for it. What you just
That's
talked
why I
about.
disagree with that. That's why I disagree when they say women got more. I disagree. I think it might be more even. It might be a little closer, all because men don't get treated for it. So I'm not saying women don't have more. Don't get me wrong. I don't want to say that because the statistics show, but I think it's not that far away. Again, men don't get treated for it. So go ahead.
Oh yeah, no, I agree. Now when you bring up that number of uh going to see a therapist and not going to see a therapist, and of course, men are, the higher percentage. But I think what this is saying is, um, it's more common in women to develop it originally than men. This is not saying not going to a therapist or going to a therapist. I think it's just saying the original diagnosis of having depression. They're saying that when women get it more than men.
I got you.
So,
I got you.
I mean, but like I said, when it comes to seeing the therapist or not, for sure, men are the higher percentage, most definitely. So you
Right.
can go ahead and read the next one.
Anxiety disorder. Anxiety disorders are characterized by intense and uncontrollable feelings of fear and worry. The most common type, generalized anxiety disorder, GAD, often co-occurs with depression, although women are twice as likely to experience GAD, which again, GAD is generalized anxiety disorder. Men are less likely to seek treatment. We just talked about that. Other types of anxiety disorders, such as social anxiety disorder, I know people like that too, also, and obsessive compulsive disorder, I know people like that as well, are equally common among men and women. Social anxiety disorder causes intense anxiety and fear in social situations. That's like somebody going out to the Fourth of July party and they see all these people, and then they got bombs going off and fireworks, and they start getting, feeling some type of way. That could
Mm-hmm.
be a challenge for people. While OCD causes the continuous repetition of specific thoughts, obsessions, or compulsive need to perform specific routines repeatedly. Compulsive. Um, yeah, anxiety disorder, compulsiveness, all these things are in GAD. I never heard of GAD. This is the first time I'm hearing about GAD when I read about it earlier. Generalized anxiety disorder. I guess if you want to say generalized anxiety disorder, I guess we all can have some of that when you look at
Right.
it from the big picture. But go ahead, man.
Oh yeah, but yeah, I've also known some social anxiety disorder people and some obsessive compulsive disorder people as well. They got to, like I said, they got to repeatedly do things. You know, like knew this one chick wouldn't. She had to like touch stuff 3 times in a row for whatever or obsessive compulsive disorder was. Like if she was like opening the door, she'd have to like turn the handle 3 times and then open it. For the
And then touch it.
longest, for the longest, it was like I was so lost in what was going on because I would see her all the time, like touch stuff. It'd be in threes, and I'm like, what is going on with this woman? What is up with her? And
Did you
then,
date her? Was
you
you
know,
dating her? Was you dating?
no, 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 no,
You
no, no. It
was
was
okay.
just a
Okay.
chick at school. Yeah, I had like 3 or 4 classes with her, and so that's how I was able to notice it all the time. Was because when you see something consistently, it gets
Right.
etched in your mind. It's there, and
Right.
so once when I ended up getting in the health class that I was in high school, then that's when I learned about obsessive compulsive disorder, and that's when it clicked for me. That's what she had. So and I learned it when I did. Uh, you know, I I knew she also social anxiety disorder. She didn't really talk to anybody or try to talk to anybody or anything like that. And but when I learned this stuff, it made me go talk to her.
Right.
It made me go to her to like kind of just put my hand out there and just say, we cool, we just, we cool, we kicking it. I mean, I'm like I said, I had like 3 or 4 classes with her, so I might as well talk to her, so
Did she
um
confide in you and tell you what was going on?
uh yes and no. I mean, it didn't really get too deep, and I don't think she was that comfortable with the
I
friendship,
got
but
you.
she was enough to
I got
talk to me periodically, things of that nature, which I was cool with. Like I said, I understood the situation. So I just, as far as she wanted to take. it. It wasn't,
Yeah,
supposed
I'm
to be
just an
no,
ear. I'm just an ear, right?
yeah, it wasn't supposed to, well, probably wasn't meant to be no go out and party type friendship or nothing like that. Like I said, we, talk during class, talk about the assignments, things like that. We, go eat lunch, every now and then again or whatever, and sit at each other and talk about what's going on in class or whatever, just so she could feel comfortable at school. Because you could tell she was on edge while she was there, you know, like she just had like nobody wanted to talk to her. And people actually wanted to talk to her, but she never really gave them the space and the time to really talk to her, present themselves to her. So, but that's another story.
Yeah, yeah.
Schizophrenia. That's a big topic too. Schizophrenia is a severe mental health condition wherein people do not interpret reality as it is. They experience hallucinations, delusions, and other forms of disordered thinking. Schizophrenia can have a significant impact on quality of life and relationships. Of those who receive schizophrenia diagnosis by the age of 30, 90% are men. Wow.
Mm, mm, mm.
90% are men. That just lets you know y'all women driving us crazy. Okay.
Ah,
Y'all making us go a little cuckoo for cuckoo puffs. But
you
and then
gonna
that
get
was that was
flagged for that one, dog. You gonna get
huh?
flagged for that one, dog. You gonna get flagged
Yeah,
for that one.
probably. Hey, somebody had to say it. Um,
Mm.
but if I get flagged, this will be a bunch of other people that need to be flagged too. In that case, I ain't no snitch or nothing like that. I'm just saying, But um, so it's it's a major issue because, like you were saying before, smiling, depression. People put masks over the fact that they hallucinate, have delusions, and things of that nature. They can be fine and open in public, but behind closed doors, they're going crazy and they're out of it. They might be able to keep it together when they're and be able to function, in the world of people. But then you don't know what they're doing or whatever when they get to the house. You don't know where their brain goes from that point on. So, but to see that 90% are men, that's incredible.
Right. The next two we already talked about. I'm not gonna go into those. This is PTSD. We already talked about accidents, assaults, combat, natural
Mm,
disasters, witnessing a death or an injury. We talked about that. We also talked about substance abuse. We talked about that. But let's talk about the treatment. Let's talk about treatment and what we can happen. So I'm going to start at treatment. Although many men are reluctant to seek and continue treatment for mental health issues, it is a vital step in recovery. With effective treatment, people can learn to manage their symptoms and begin to feel better. Some treatment options include psychotherapy. Therapy can help people work through issues that have triggered mental health conditions. It can also help individuals manage their symptoms, change their negative thoughts and unhelpful behaviors, and learn how new coping skills. I agree with that. There are many different styles of therapy. In order to be effective, it is essential that people find the right therapy and type of therapy for them. What's your thoughts on that, Phil? Talking about treatment, therapy.
uh, well,
Can you see the common man going to get therapy? Let me ask you that.
no,
And why is that? What's the roadblocks to a man getting therapy? What are the roadblocks?
their ego.
Mm,
They feel
mm,
like they're too macho and too manly to go
mm.
sit on somebody's couch and talk to them and let out their problems. What people don't understand is that the more you build up, that's what puts you in that position of losing your mind. when you take on so much and you let it all build up, eventually your body just breaks, your mind breaks, because it can't take on any more, problems that you're having when all you had to do was go. And it's not like, and like we said, you ain't even got to go to a therapist. If you a man, all you got to do is call. If you got a real true homie, that's gonna sit there and listen to you. I mean, yeah, your homie's gonna crack jokes. That's your homie. That's how that relationship is supposed to go. That's like if I call Mr. Cook and tell him, man, I don't know about this chick, like letting, and he go, man, chick's crazy as hell, or whatever the case may be. It's gonna be some comedy in there somewhere. It's not to say that men
just to
don't
break the
care.
ice. Yeah, just to
Right,
break the ice.
we're guys. That's pretty much how we. That's like, I'm gonna give you a perfect example. My stepdad is a jokester of all jokesters. That's all he do is play jokes. From the time I was little, when he got with my mom to this current day, he is a jokester. And if I called him and told him about some relationship problem, uh, you know, there's gonna be some jokes coming. But he also knows to be serious. So if I called him about a job issue, he would get serious about that, because that's for sure something important that you have to take serious. So when you got dudes like that in your life that know playtime from serious time, that's when you can go to them and say, "Hey, man, I'm dealing with X, Y, Z." And you never know what open your mouth can give you, because you never know who they know that may be able to help you. Whether
True.
it's financially, or whether it's just may even have a therapist that's cool that they went to. It's like, hey man, I'm gonna give you this number. Go ahead and talk to so and so, or set up a meeting with so and so, and get your stuff worked out, or whatever the case may be. You gotta stop trying to be so macho. I mean, it's a time to be macho, and it's a time to be serious. Those are two different things.
I agree with you. I agree with you, man. That's very true. And the problem when you say ego, the challenge we have as men are, being vulnerable. As when we were kids, we were never taught to be vulnerable, be tough. Be a man. Don't be crying. Don't be crying. Be tough. All that stuff. And so therefore we held our emotions in from the day one. On the football field, you might have got rocked on the football field. I see dudes cry on the football field, and when you cry on the football field, dude, you get tagged for the rest of your life. I was I played little league with this dude, man, and he cried on the football field. And every time I went to middle school with him, I used to look at him like, no matter what he said, I used to be like, dude, you cried on the football field. And see, that's I can keep it real, man. I got them male tendencies too, and again, I just did, So being vulnerable is hard for men, because of that, because other men gonna look at you a certain way, and I keep it real though. Every time I look at that dude's face, I never forget, man. That was the first time I was little league, man. I watched this dude cry on the football field, and I'm sitting there like, what you doing? That's the last thing we ain't supposed to be out here doing that. I do that, from the get go.
Right.
So, yeah. So again, I think that's where it is. We're not taught to be vulnerable, so we can't let that. Yeah, you even start laughing. You do that's like sacrilegious to even cry on the football field. You know what I'm talking
Oh
about?
yeah, no, you
I
don't
can
do that.
Right. I can see you crying after a game you might have lost, because you're so mad because you wanted to win that game. Now, that's
I've
that's that's
done that.
yeah, I've done
I've
that
done
too.
that.
I've done that too. But I'm talking about somebody whack you and you sitting on the sideline. We had practice. We tearing up. I'm sitting there like, oh man, I don't know if I could ever take you serious for the rest of my life because I saw you cry on the football field. Oh, that's crazy. Anyway, man. Wow. Yeah. Let's go to this next one, man. Medication. And Phil, I don't know, man. You said, I'm gonna go back to what you said. You said You don't need no therapy. You can just go see your friend. I disagree with that, man. I think dudes need to go see a professional therapist. All because now some people might have good friends enough where they can talk to them and they can help you, release some stress and everything. I believe I do, but I don't know. I think if it's pretty bad, man, I think you might need somebody who got some some letters on their walls as far as credentials that they can
Well,
help you.
what I
But
meant necessarily was start somewhere.
I got you.
You know,
I'm with that
start
now. I'm
somewhere.
with that.
Start if you got to start with your friends and then make your way to the
I'm with
therapist
that.
for you to feel comfortable. Then do
With
that.
that.
That's more or less what I meant. What I meant to say.
I'm with that. I'm with that. A doctor, let me read this real quick. Medications. A doctor may prescribe medications to treat various mental health conditions or symptoms associated with those illness. For example, they may prescribe antidepressants, anti-anxiety medication, anti-psychoactive drugs, sleep aids. Typical doctors will recommend that people use medications in combination with psychotherapy. I'd rather get the therapy than any medication. That's just me personally. I'm already taking medication. I don't even take no medication for my brain. So, but I believe in therapy opposed to just taking a pill. I think that's gonna work. That's my thought.
I would say this, and this is just a kind of a plug for a person we just recently had on our show. When it comes to medication and you're having, going through these brain challenges and issues and things of that nature, and you don't kind of know, but you have doctors prescribing you medication, and you're not sure if you should take it or if it's good for you. Uh, Go contact Kriss. She's on LinkedIn. I believe she's on Facebook as well. I know for sure she's on LinkedIn because that's where I met her. Um, and talk to her about it. She works with um, uh, a business that deals with medication for, I think, for depression or mental health. So contact her, talk to her, find out what the best things are to take for your specific illness. She's a great person and very open and willing to listen to what you have to say. So definitely go check her out. So that's all I'm gonna say on that because I'm not too keen with the medication. But I agree with you. I ain't taking nothing that's touching my brain. Any medication touching my brain, I'm good on that.
Right.
You messing up nothing I already got going on up there. So, um, but lifestyle changes.
I'm
Um,
down with the
make
lifestyle change.
hmm.
I'm sorry. Go ahead. I'm gonna let you finish from the back.
I was just going to the next one. What was you saying?
I said I'm down with lifestyle changes. Go ahead.
Oh, lifestyle changes. Making positive lifestyle changes can make a significant contribution to mental well-being. For example, it is important to eat a balanced diet. We talk about that continuously. Get enough sleep.
Agreed.
Exercise on
Agreed.
most days. Talk about that. Stress through meditation or yoga or other ways. We brought that up a lot earlier in the time
Hey, I
that
do all these. I do all these. I eat a good balanced diet. I try to get enough sleep. I have challenges with that every now and then, but I exercise most days. I meditate and I do yoga. But go ahead, man. I'm sorry to cut you off.
oh, you good. Limit or avoid the use of alcohol and drugs. Um, I can say for sure that um, two of these things for sure, well, three of these things for sure that I'm good at. Eating a balanced diet. I exercise on most days, and I avoid the use of alcohol and drugs. I had the thought of starting meditation, maybe yoga, and I don't get the sleep that I should. I know that. I just I think I've come to the conclusion that it's just because my body has been in a hospital so many times over the past 13 years that it's just now just kind of used to being up at night because I can really go to sleep because if I by the time I try to go to sleep, somebody was knocking on my door to come give me medication or come take blood or do this or do that. And I'm like, when are y'all gonna let me sleep? So at this point, I don't really sleep. I don't fall asleep till about 2, 3 o'clock in the morning, sometimes 4, and I wake right back up at about 7 or 8. Mostly on dialysis days, I wake up around 8:30. Days I gotta go to class, I gotta be there at 8, so I wake up usually like around 7:30 because my school is right down the street. So, um, but yeah, I will confess I don't get enough sleep at all. And I have not started the meditation or yoga part yet. I've been thinking about it and just trying to figure out the right way to go with that. So, but
Well, one thing I could say about meditation, man, meditation could be as simple as you waking up, you sitting on your bed, and you put your timer on for 5 minutes, and you just close your eyes. And you just, think about, try to think about your thoughts, or just let yourself calm down while you're up. That's meditation. It could be 5 minutes. You can just sit there for 5 minutes in a peaceful state and just go within. That's meditation. It don't have to be no big thing. So I tell people that all the time. Just start with 5 minutes. I meditate every morning when I get up. I meditate. I pray. I meditate. I go through my gratitude because that's my attitude stuff. Then I exercise. That's my morning ritual. Then after I exercise, I eat my food. Then after that, I'm coming in this office and I'm working with clients, kidney care coaches, or I'm working on my book, or doing something kidney related, studying kidney, something. I'm doing something kidney related, that's for sure. So that's my life. But let's go to the next one. Peer support. That's one thing you and I talked about earlier, man, which is very, very big. Attending a support group or group counseling can be very helpful for those with mental health conditions, for sure. And like Phil said, and I'm in agreement with Phil, but I also think sometimes we might need a therapist. But a peer group can be your friend, like Phil said. It could be somebody you're cool with and you can confide in. I have friends like that I can go deep in and tell my deepest thoughts, my deepest challenges. And they respect my time and they respect me and I respect them when they tell me theirs also. And it stays right there when we talk about. It don't leave. And I respect it, like I said, and it helps me, man. When I get off the phone with them, or if I see them in public and we have a cigar, it helps me. I got a dude here. I was outside, and me and him talked, and we talked, and again, it helped me just talking to him because it lets me know sometimes that I'm not in the only boat doing, going through some of the stuff. And I let him know you ain't the only one going through some of the stuff. So that's real. What's your thoughts on the peer support?
I agree with the support. I didn't think about the support group or group counseling aspect of it, and that's important because what that can do is just like for people with kidney failure, liver failure, heart, any organ failure, cancer, anything like that. It's a lot of times before you meet other people, you feel like you're just doing this by yourself and you're the only one that's doing it. So to meet other people that's going through the same thing, through kind of push your mind at ease that it's okay and I'm gonna make it through it. I mean, I that's how I felt uh when I went to the transplant games. Like I said, I didn't know anybody that was a kidney patient from the day I was diagnosed at 4 to 16 when when I still didn't know nobody. When I had my transplant, the first person I met was actually the person who was getting the other kidney from the person I was getting mine from. That was literally the first person that I met that had kidney failure as well. And then when I went to transplant games, it's all kind of settled down for me because I was looking at thousands of people who were going
That's
through the same
crazy.
thing that I was
Right.
going through, you know. And so, support groups and group counselings are very important because, like I said, it kind of puts everything at ease for you when you realize that you're not going through this, alone. You can be support for somebody, even though you're going through something. and you're going through the same things, you can still be support for someone, and they can be support for you as well.
Right, right. I'm with that, man. I agree with everything you're saying because iron sharpens iron. You want to go to this prevention one, or are we done right there?
Yeah, no, we got prevention. It says there is no sure way to prevent mental health conditions. However, the following steps may reduce the risk of developing one. Communicate with family and friends, especially during stressful periods. That just goes back to what we were saying about being able to confide in somebody that's close to you, that's a friend. I mean, family is a little bit more important than friends, unless you just have friends that are like family to you. Of course, we all have those specific friends. Um, but your family, 9 times out of 10, are the reasons why you continue to live and still be here. I know that's my reason why I fight every day is my family. So, and of course I got like I said, my close friends that are like family. So, um, but communicate when you feel that burden coming on you, you feel like you're going through something, or you feel like just kind of like something is off. Talk to your family, talk to your friends. When you get into, like I said, especially during those stressful periods, when you're going through something and you just feel like I might not make it through this. That's the time when you need to talk. When you feel like
Yeah,
you not gonna make it or you can't get through something, it's time to open up and start talking.
right. I'm just gonna read. You want to just read through these, man, instead of because we're past our time, so we gotta hurry
Yeah,
up.
I could read through them.
Yeah, just read through
Seek treatment promptly if any symptoms of poor mental health develop. Continue with maintenance treatment to prevent relapse of depression and other mental health conditions. Learn to through meditation, mindfulness, creative outlets, or other methods. Sorry. Practice positive lifestyle choices such as eating well, sleeping enough, and exercising. See a therapist for issues such as low self-esteem or childhood trauma, which could trigger mental health problems later in life.
them. And I'm gonna read through these real quick, man. How to help. Um, Look for changes in a person's behavior and mood. These may indicate the development of mental health issues. Talk to the person and ask them how they are feeling. This is especially important if they have just experienced an upsetting event, such as divorce, uh, bereavement, or
Bereavement.
retirement. I'm sorry, bereavement. Yeah, I couldn't even pronounce that. I didn't know what that was. Encourage them to talk to their doctor or a mental health professional. Offer to look up treatment providers. Make an appointment for them or attend their treatment with them. That's big. Check in with them regular to see how they are. Now, that's a big one right there. Just, hey, man, I'm just thinking about you. You good? Yeah, I'm good. Thanks, man. Thanks for checking up on me. People appreciate that. If someone is at risk of suicide, do not leave them alone. Call 911 and wait with them until help arrives. I agree with that also. That's a very very big important one also, man. I think all those preventions and all those ways how to help are very very important. Whew, I think they're big. And what's good about that is, you know, during this whole podcast, you and I talked about the prevention and things like that. And the same thing we said are the same thing they're echoing right now, because you and I talked about those as we went along. So I think this is a good one, man. I think this is a very, very good one. I think people need to listen. I think we need to take it a little bit more serious, especially in men, because again, we don't talk to each other. So just a checkup text for our fellas every now and then to see if they doing well, or a call. Man, I ain't one that just wanted to talk to you and see how you was doing, and just keep it moving. Say you was on my mind, stuff like that. So it's all good, man. I don't have nothing to say, but again, this was a good podcast, and I'm really, really grateful that we did.
Oh yeah, definitely, man. It was great to be able to bring this information to the forefront. It's important, it's needed to be known. Um, And so it's like I said, it's very important for this information to be put out there because, like we said earlier, uh, men's ego get in the way of them saying, "Hey, I need help." They feel like they have to be too masculine. Just deal with it. Deal true. Like I said, if you don't feel comfortable confiding in family or your friends, you feel to take you serious enough. It's real easy to get in touch with a therapist. Like this, like I said, they have to keep that stuff, under confidentiality. They have to keep that stuff, a secret. They can't tell anybody, what you tell them. So it's not like your stuff gonna be out drinking and then your business gonna be burned out. So I mean that's one thing that can happen with your friends, especially if they drink a lot, or do drugs. You can't control your mind, can't control your body. So, but if it's one thing you guys, you men can take from this is you're not too manly to talk to someone. Get that through your head that it's uh, to open up sometimes because the less you let out, the less problems that build up. Because the you deal with stuff at work, you're dealing with stuff at home, you're dealing with stuff with your kids, maybe in college, you're trying to pay their tuition and do things, and you just letting all these build up. And like I said before, the more you let it's gonna get to a point it can't hold no more. Your body and your mind is gonna break. So that for what it's worth, I hope you all we said today. Um, great conversation. We'll definitely be back on Wednesday. With Bart. Oh no, Miss you said you're gonna be gone.
No,
Next
Wednesday we
week,
good.
next. Oh, okay, you'll be okay. Oh, that's right. No, that's the
The
next
ninth,
next
I
Wednesday.
leave the 19th. I leave the
So yeah,
19th. Yeah.
that's the next. I'm getting my days mixed up. But yeah, I'm just ask you all to pray for me. I'm having a procedure done tomorrow to check the how bad my heart is leaking. So I'm hoping that the best news possible comes from that this procedure. So I'll
You
spare
got
you the
this, brother.
details on what can happen if it's bad. So if you want to know, you can always hit me up on Facebook, Instagram, whatever, LinkedIn, whatever you have me as a friend on. So, and I'll be more than happy to discuss it with you. So, again, Mr. Cook, I appreciate your time. Everybody that
I
was watching
appreciate you, man, and I just want to tell you that
today,
I appreciate you. I appreciate you too, man. I just want to say you got this tomorrow, man. All good. Everything's good.
appreciate you, brother. Um, everybody else watching today, thank you. If you had a question, you just didn't put in a comment, you kind of, if you want to ask it, ask it. Closed mouth don't get fed. So go ahead, comments. We'll be more than happy to do it and answer it for you. If we don't have an answer, we definitely know somebody who knows an answer for your question for sure. We have too many uh, uh, to not know somebody. I appreciate you, Mr. Fred Hill. And so, the replay, you still have questions, drop them in the comments. We'll be happy to come back to you and answer them for you. With all that said, you guys have a blessed night, have a blessed week. We won't have a motivational Monday tomorrow, but if you can, go over to Fred Hill's channel, have motivation with Fred Hill at 10:15 in the morning. Go ahead and get that word of encouragement from Mr. Fred Hill. He's always, dropping it every Monday as well as with Motivational Monday. So tune in definitely to Fred Hill, Motivation with Fred Hill tomorrow morning. We'll see you all on Wednesday.
Peace.